I remember in massage school, my friends would always ask me, do you have to massage people's butts? And the answer is yes, you do. And although that was always intended as a joke, something to laugh about, you quickly realize that massaging the glutes is anything but. The hips and glutes are one of the most important areas to work during a massage, hands down. So today let's talk about why that is and how to properly massage this area. What's going on, guys? Spencer here with HM Massage, back with another video. Today we are going over how to massage the glutes and the hips. Now there can always be a jest at massaging the hips, especially when you're brand new. Addressing the glutes and the hips as a muscle and not just a butt can be a little bit of a hill to climb. It's funny, we call our butt our bottom, but it's right in the middle of our body. Yet, despite its importance to our structure, it can often go undertreated and overlooked. So today, let's go over how to properly massage the hips and the glutes. First things first, when it comes to massaging the glutes, we have to talk about draping. The most primary concern is that your client feels comfortable. For the longest time, I would simply massage the glutes through the sheets. And even working through the sheets, I achieved high quality work with long-lasting results. There was no hindrance just because I had a sheet in my way. So if the client doesn't want skin-on-skin contact with their glutes, it doesn't mean you just walk away and say, well, can't do anything. We can still achieve really great work, even without going skin to skin. However, if the client is okay with going bare skin, then this is even better because it's always nice to massage with the most contact. So you just want to ensure that the draping covers the sacrum and the gluteal cleft and is tightly pulled and tucked underneath the client. And then we can begin to warm up the muscles like we do any other massage. I actually like to start the massage down at the posterior knee and then work up towards the glutes. So we're getting a bit of hamstring relaxation, and it's a nice way to work into working these gluteal muscles. Working up the hamstrings to the ischial tuberosity, that's your sits bone, and although they are the hamstrings, a leg muscle, they will tie right into the hips. Once we get up into the glutes though, we're going to be doing a lot of warm-up along the iliac crest and sacral border, all just loosening it up. And then some nice effleurage circles. I like to use stacked hands initially, and just going slow, taking our time, feeling the tissue relax beneath your hands, and warm up. Begin to get a familiarity with the anatomy we're working on. The pelvis or hip bone is going to be made up of the ilium at the top, the ischium below it, and then the pubis bones. As the warm-up continues and we begin to find areas that are more stuck, we can sink in and apply some more sustained pressure to those areas. Still using my fingertips, we're gonna get into the elbow later. You guys know me, you know I'm all about the elbows. But at the beginning, we can still get some pretty nice work done with fingertips. After fingertips and before the elbow though, a nice transitioning point is the knuckle. This will apply a good amount of deeper pressure, and for some clients, maybe this is all you need. You might not even need to get into the elbow. But a nice knuckle to start working past the superficial muscles. So superficially we have the gluteus maximus, the king of all muscles that everyone knows. Sounds like a name from Sparta. And then alongside that, we have gluteus medius. A lot of people don't know that you actually have 3 glute muscles. So if you have a glute maximus, you must have a glute minimus. And then there is the glute medius in the middle. So glute max is a superficial muscle. We just need to warm that up. And then glute medius lies a little deeper, a little bit more towards the iliac crest and sacrum. And the glute medius holds a few trigger points that hurt everyone. I find a lot of clients suffer from glute medius tension. Deep to the glute medius, once we work through that, we're going to hit glute minimus, which lies below glute maximus, and then piriformis, which is our biggest lateral rotator. Sciatica or piriformis syndrome are very common hip ailments, and that is caused from the piriformis muscle getting too tight and pinching that sciatic nerve. So with the idea of the layered muscles, we can work in deeper, and here I like to transition into the elbow because I'll begin targeting glute medius with some nice pressure, and then the piriformis. And the piriformis is going to originate on the sacrum and insert onto the greater trochanter, which is why I like to have a nice diagonal with my elbow. I'm applying pressure transversely to the piriformis, essentially trying to get a slow cross-fiber friction. This, I find, provides a good amount of pain for a lot of clients, definitely. But as long as the pain is never too high, I will never take somebody past a 7 out of 10. Then the work is going to outweigh the temporary uncomfortabilities. A lot of hips are deep, thick muscles too, so it takes some time to allow our body to sink into these muscles. You can see the slow speed at which I'm applying this deep pressure with my elbow. And in between our deep, deep strokes, we're gonna back out and just make nice to an area with some nice effleurage before we go back into another deep stroke. Now this time, I've switched it up. I am applying the pressure to the same angle. However, I'm using my other elbow, which will also save my hands and joints, but it applies a slightly different pressure to these hip muscles, and angles are really important when it comes to massage. A massage can have a very different feel depending on the angle that you press in at. And this angle I really like to follow up with because it really helps to clear out any areas that are still residually stuck. With the deep pressure underway, it's time to really send it home. This next technique is excellent. It's going to shorten the glute and quad muscles and allow us to get some very nice intentional work done on all of the hip muscles. What you're going to do is have the client flex their leg and then externally rotate it. And that is going to create the frog position, as I call it. This is such a great position because you have great access to the glutes, especially glute medius, but also the IT band and some of the quads and TFL. Make sure the draping is still tight as you transition the leg, and as you sink into the glutes, you'll realize how much softer these muscles are. This provides great access to the head of the femur and lets us sink into those deep hip rotators. The shortening of the glute muscles allows you to really pinpoint some muscle adhesions in the hip and get a lot of that deeper tissue work done before we transition down to the IT band. But then we're going to work into warming up the IT band starting distally at the knee and working proximally towards the hip. Don't just stick right on the IT band though. Make sure to loosen up the attachment of the quads in the IT band. Those two areas love to get stuck together. It's a forbidden relationship, and we need to break those apart. We can use our knuckles even here, making sure you control your pressure since IT band work is really painful for a lot of people, but supporting the wrist and feel free to go into the knuckle, achieving that deeper pressure. Follow up all the way through to the hip flexors and the TFL up at the top right there. The hip flexor and TFL work that we can do here is actually a big reason why I love this position so much. Because it does give us access to a muscle that would normally be targeted when a client is face up or supine. Now we can keep the client prone and still get some quality work on an anterior muscle. Sinking into the glute medius here once again, doing a nice rhythmic, almost jostling, but with more included pressure, and this is really going to restore and free the hip bones, the femur. Transitioning back to our IT band glide using the palms, a slow compression-like glide working all the way up to the IT band and wrapping around the front of the hip. And following the knuckle and IT band quad work, this is a great showcase of the anterior work that we're getting done. And this position just allows us to get into that hip flexor and TFL right in there. Such a great angle, such good work. Your client's gonna love it. When we finish up the deep work, back out and make nice with some lighter work real quick. And then we're going to re-straighten the leg. You'll see I give it a little shake just to make sure that no joints are caught. And we're gonna go into our final technique, a pin and stretch. Bend in the knee, apply deep straight pressure with your knuckles, and then we're rotating the femur back and forth, taking it into internal rotation, applying that pressure right into the meat of the glutes, and then externally rotating the femur outward. This is an excellent pin and stretch technique that is going to free the ball and socket joint of the hip. And even here, you can take them into a lot further of a rotation. Just be sure to check in with your client on their own limitations. And finally, as we wrap up the massage, finish your pin and stretch, and then straighten out their leg, giving it a little shake so that nothing is caught up or stuck, and then cover up their leg and move on. Thank you so much for watching, guys. I hope you enjoyed the video and it helped you out. Give it a thumbs up if you did, and don't forget to comment and subscribe for more content. I will see you guys on the next video. I hope you have a great rest of your day.